What's up guys, it's Derek Z, physical therapist here again. Welcome back to another video. In today's video, I'll cover how to prepare for a total hip replacement. A total hip replacement is usually considered when there is ongoing pain or functional limitations within that hip. So these functional limitations can include like walking, going up down stairs, getting into out of a bathtub, getting into out of a car, or just standing for a prolonged period of time for cooking or anything like that. These are things that are heavily involved in our daily activities. When the decision is finalized to go through with the surgery, sometimes what happens is the orthopedic surgeons will send their patients to a physical therapist for one visit of prehab. Now in a prehab visit, what happens is the physical therapist will go over with the patient how to prepare for a total hip replacement. Now I will go over with you what I go over with my patients so you will know how to prepare for a total hip replacement. One of the things that I always talk to my patients about when they're ready to go through with the total hip replacement is stairs. The amount of stairs they have to get into the house and the number of stairs that they have to get to the bedroom. Now it's usually most ideal if they can have a one floor setup. If there's a place that they can stay where they have access to their bedroom, their bathroom, and the kitchen all in one level, so there's minimal amount of navigation for stairs. And the reason for this is because in the beginning, your ability to be able to walk and do stairs is going to be limited because you automatically lose quite a bit of strength right after that surgery. Now, if you need to learn how to do stairs right after a total hip replacement or a total knee replacement, I actually made a video on that prior, so you can look back into my history, and I will post the link in the description below. In addition to that, you'll also need to learn how to use a walker right after the surgery. I also made a video on that, and I'll post that in the description below as well. Alright, so the next couple of items are going to be helpful to you in terms of self-care tips and strategies in the first couple days after surgery. Okay, so tip number one is going to be remove clutter around the house. Clutter such as cords, wires, rugs, etc. Anything that can increase your likelihood of falls after surgery. In the first couple of days or so, or even the first couple of weeks or so, you're going to be using a walker because walking is going to be difficult as a result of the surgery. You're going to lose a significant amount of strength in that leg, so walking is going to be an issue. When you use a walker, if you're not used to it, it's going to be harder for you to navigate around and just for you to get around in general. Because of that, you don't want things to be in the way, and if they're in the way, your likelihood of falls is going to be higher, and we don't want that. Safety is the number one priority. Alright, so tip number two is going to be setting up a night light for your path to the bathroom or to the bathroom itself. So the reason for this is because at night, walking is going to be difficult already because of the surgery. Now you add a lack of vision to it, and your likelihood of falls goes up even more. So because for the reason of safety, you want to be able to light that path, and so that way getting there would be easier at night. Tip number three is going to be prepare your meals and do your laundry ahead of time. This is very important, especially if you live alone. So these are things where you can get done ahead of time. So once after the surgery, getting the meal or putting on clothes, those things are already prepared and ready to go. And you don't really want to be standing around and cooking with a walker or a cane when the walker or the cane itself can be a hazard and making you fall. In terms of the laundry, you don't really want to be carrying anything heavy anyways right after surgery, because that, and again, can contribute to a fall as well. Again, safety is number one. Another thing to consider is know how and know who is taking you to therapy. So then that way, transportation itself won't be a barrier to your recovery. Tip number four is going to be wearing sweatpants or loose clothes or shorts when you go to therapy. Now with that said, not everybody with a total hip replacement will get therapy. Sometimes the orthopedic surgeons, when you have your first follow-up and you seem to be doing pretty well, they don't recommend therapy at all, which is totally fine. But at the same time, if you do get recommended for therapy, then what happens is when you wear shorts or just loose clothing, it will be very helpful for your physical therapist, and it makes it very easy for us to monitor your incision for anything bad such as an infection. So for tip number five, this is important for those of you who does not have a one floor setup. So if you don't have a one floor setup, bring the things that you need with you so you don't have to go up and down stairs to get them again. So these are things that would be like water, your phone, snacks or food, the work that you need to do throughout the day if you're still working after surgery, or if you're working from home. or whatever it is that you need. These are things that will help you minimize the amount of stairs that you need to go up and down throughout the day. So the next tip is going to be about home medical equipment to make life a little bit easier while you're at home. So one of the things that most of my patients really like is the reacher. This is something that can help you get something off the floor or in a place that's hard to reach for things. And the main reason for this tool is because you're going to have problems bending at the hip because of the surgery. The reacher will solve that problem for you. The equipment number 2 is going to be the sock puller. It's going to be because, again, you're going to have problems bending at your hips, and putting on your socks and shoes is going to be very difficult. So the sock puller is something that will be helpful for you to be able to solve that problem itself. The third thing that most of my patients usually get is a commode or elevated toilet seat. And the reason for this is because having the toilet seat higher will prevent you from bending at the hips a little bit more. So as a result, you're going to be able to use the bathroom without pain. Last but not least, it's going to be the shower bench. So then that way you can get into the shower without standing there for a long period of time. And in the beginning, you won't be able to submerge your hip in water anyways because of the incision that's still there. So having a shower bench will allow you to be able to clean yourself and take care of personal hygiene without compromising the integrity of the incision. All right, the last tip that I have to talk about is going to be about hip precautions. This is going to be very specific to your surgeon. So please ask your surgeon or your physical therapist what precautions you have to be mindful of. There's usually 3 approaches that I have seen or that I have read of in the literature. So there is an anterior approach, there is a lateral approach, and there is a posterior approach. These approaches basically means that is a direction in which the surgeon went in to do the surgery. So each approach has different precautions, and these precautions are basically movements of your legs that you can or cannot do. So please verify this with your surgeon or with your physical therapist so then you know what you should be mindful of, because each one is a little bit different and each surgeon have their own preferences. When it comes to exercises, research has shown that your hip abductor strength and your knee extensor strength preoperatively are good, reliable predictors of how well you can walk after surgery. So your hip abductors are basically muscles on the side of your hip that are called gluteus medius and gluteus minimus. Okay, these are tiny muscles on the side of your hip that essentially is responsible for stabilizing the hip. Your knee extensors are basically muscles in the front of your thigh. These are your quadriceps. So these muscles, if they're strong beforehand, before you undergo surgery, they will provide you the ability to be able to walk afterwards. So your outcome will be higher. Also, research has also shown that if you've gotten PT before surgery, your need for post-op acute care, in-home services, and skilled nursing facility care are much lower compared to if you did not have PT. So I'm going to show you some exercises that will essentially focus on the hips and the knees. So then that way you can get the best outcomes possible. So in a nutshell, if you strengthen your quads and your hips before surgery, your outcomes will be better and your mobility levels will be higher. So then that way you will be more independent after surgery. The difficulty of these exercises will vary in degree depending on individual to individual. So try these out and see which ones feel better and which ones feel best for you. And what I mean by that is which one is challenging but doable, okay, provided that you maintain good form. So let's jump right into it.
The quad set is one of the rudimentary exercises that teaches you how to engage your quad. To perform this exercise, you want to put a towel either underneath the ankle or underneath the knee. So what you want to do is you want to go ahead and push your knee down into the table. As you do that, you will go ahead and squeeze and make a muscle tight in the front of your thigh. The straight leg raise is a much harder version than the quad set. So this exercise also focuses on engagement of the quad as well while moving the lower limb. So to perform this exercise, basically what you want to do is you want to point your ankle towards you. Holding that towards you, you want to keep the leg nice and stiff and then make a muscle in the front of the thigh. As you do that, you want to lift the entire leg up to the height of the other knee. When you lower the leg, you don't want to disengage your quad. You want to just tap the heel on the table and bring it right back up, keeping your leg nice and stiff throughout the entire arc of motion. The long arc quad, or LAQ for short, is another exercise that focuses on engagement of the quad as well, because that's the knee extensor. So what you want to do to perform this exercise is you can either sit in a chair or at the edge of a table like it's shown, and you want to point your ankle towards you, point your toes up, and then lift the lower leg up. As you do that and extend the knee, what you're going to do is you're going to focus your engagement in the front of the thigh. If you're doing this correctly, the burn should be in the front of your thigh, which is where your quads are. The side lying hip abduction, or the side lying leg raise, is an exercise that focuses on engagement of the hip, particularly a muscle called the gluteus medius. This muscle is very important, particularly for a total hip replacement, because it's responsible for keeping your pelvis level during single leg stance. This is also a muscle that can cause a lot of problems as well. If it's dysfunctional, it can essentially cause low back pain, hip pain, knee pain, and sometimes it can go as far as the ankle and the foot. When you do this exercise, most people end up doing this wrong, I find, in the clinic. So what happens is, what you want to do is you want to go ahead and lay on your side, and as you lay on your side, you want to make sure your hips are stacked right on top of each other. And the other thing is, when you're lifting your leg, you want the leg to be a little bit behind you or in line with your trunk. What you don't want is, you don't want the leg to be in front of you. This will ensure that you bias the gluteus medius so you can get the maximum potential possible. The prone hip extension. This is an exercise that focuses on activation of your glutes, particularly the gluteus maximus, or I call it glute max for short. To perform this exercise, what you want to do is you want to go ahead and lay on your stomach. As you lay on your stomach, focus your engagement or focus your mind in where your butt is. Squeeze your butt together first before you lift the leg. So as you squeeze the butt, hold that there, and then go ahead and lift the leg from there. This muscle is actually very important in the lower part of the body. The glute max is one of the most powerful muscle groups in the lower part of the body, because it allows us to get up off from the floor, to climb stairs, or to even get up from like a low surface. The CLAM. This is an exercise that focuses on activation of the gluteus medius, which is essentially your hip stabilizer. So to perform this exercise, what you want to do is you want to lay on your side. So the leg that you're working on is going to be the leg that's going to be on top. When you lay on your side, stack your hips on top of each other, just like how you were doing the side lying leg raise, and then make sure your feet is on top of each other as well too. So your hips and your feet don't move when you're doing this exercise. The really only thing that moves is going to be your knees that separate from each other. The other thing you want to focus on is, when you're doing this, when you're lifting your leg up, you don't want to be rolling backwards. You want to make sure, again, your hips continue to stay stacked. So you don't want to roll your entire trunk backwards and over open when you're doing this exercise. If you're doing this correctly, you should be feeling this in the back and the outside of your hip. Bridging is a very common exercise to help strengthen your hips. This exercise focuses muscle engagement in your glute max, which is kind of like what I would mention at first, one of the most powerful muscle groups in the lower part of the body. So to perform this exercise, what you want to do is you want to lay on your back, both knees are bent, and what you want to do is you want to align your ankle, your knees, and your hips in line with your shoulder. From there, you want to press down in your heels and then lift up from there. Pressing down in your heel will focus the engagement of the muscle activity in your hips, so allowing you to feel that a little bit more and get more bang for your buck. The squat is a nice functional exercise that works on multiple joints and multiple muscle groups. So this actually gets both the hips and the quads at the same time. So to perform this exercise, there are a lot of cues to get the squat done correctly. Usually the one I use is just pull up a chair behind you, act like you're sitting down, but don't actually completely sit down. Just sit down to the chair to the point where your butt touches the chair, and then just come on back up. Make sure your hips just go backwards as if you're about to sit in a chair, but don't actually completely sit down. The band walk is an exercise that focuses engagement of the glute med. So to perform this exercise, you can either have the band a little bit above the knees, which is the easiest, at the ankle, which is moderate resistance, or over around the forefoot, which is essentially the hardest. So when you do this exercise, what you want to focus on is not let the trunk sway left and right when you're doing this, making sure it's nice and stable. and you don't want to bring your knees or your feet in together, keeping space apart. The lateral step down is another great functional exercise because it's a multi-joint movement. Whenever there's a multi-joint movement, multiple muscles will be involved, and in this case it's going to be your quad and your hip. So when you do this exercise, form is pretty important. And the reason I say this because if you do this incorrectly with your knees going way past over your toes, then what happens is you're going to put a lot of stress over your knee, and essentially that can cause some dysfunction and maybe resulting in some pain there as well. So when you're doing this exercise, there's a couple points that you need to focus on. One is your hip. You don't want to be reaching towards the floor with your heel. And two, you want to keep your hips level. You want to imagine your hips is like a bucket of water, and you don't want to tilt your hips in either side, left or right, making your water spill. And three, you don't want your knees going past your toes. And lastly, you don't want your knees going inward as well too. When you're doing this, if you're able to maintain all the form there, then you'll get a good amount of benefits from this exercise. Doing eccentric step over is a great way for single leg training, particularly if you have trouble going downstairs. And this is something that's to be expected probably right after the total hip replacement, or some of my patients, if not most of my patients, already have that trouble before the surgery. So when you're doing this exercise, you want to go up with the weak leg, so that way you work the weak leg, and when you come down, you want to come down with the strong leg. And the reason for that is because you want the weak one to slow you down when you're coming down the step. So that's why the emphasis on the eccentric and the emphasis on coming down slow, so you're really getting those muscle activity going in the quad and the hip.
This is information in which I pretty much share with my own patients and I teach them about. So if you have any questions or comments, please leave in the comment section below. If you like this content, please consider subscribing and liking this video. It will really help support my channel. Thanks for watching. I'll see you in the next video.